So on Sheryl Sandberg's backing, there's the cash injection. But what does a kind of long-time tech executive like that bring you beyond just the money?
Well, we are very proud and honored of having Sheryl and Tom as an investor, like the rest of the investors in Cercle. We are committed to improve women's health, and we are committed to do it using data, and they are sharing that vision and that commitment because it's huge possibilities and room for improvement in women's health because it's massively underserved. Historically, they have been out of medical studies until 30 years ago. There are roughly around 700 diseases that they take 4.5 years to be diagnosed properly versus men. And the overall investment in women's health is below 2% if you exclude oncology. So you can imagine that there is room of opportunities to improve women's health, and using data, we can do that. So we are very successful now. We are working with US Fertility, that is the largest clinic in the US by far. We are also in Mexico, Argentina, and Colombia, and Europe with Eurofins, is one of the biggest lab testing companies in genetics. So having the support of people like Sheryl and Tom is just going to help us to scale and make the company bigger and have a bigger impact.
Juan Carlos, how does the technology work?
So I think the main difference between us and everyone else is the scale and the resolution. We want to enable personalized and precision medicine on women. And basically what it means is that every woman is different, and what it works for some women doesn't work for others. We provide the tools and the data to the healthcare system to understand those differences, to provide the best solution for each of those women. It's basically what FDA calls real-world data, real-world evidence. So you need to understand the historical data in order that you can provide the best recommendation and the best solution for a new patient walking into the clinic or for a new drug development. So if we go ahead.
Well, I'm interested in that data and that data collection. It says on your website that you strive to meet HIPAA compliance standards to ensure that privacy. But striving doesn't always mean hitting. How are you ensuring that this privacy to data remains, I'm sure, top of mind?
So this is a very important question, and I'm thankful you're asking. So we are building this biomedical and genomics graph that basically connects billions of data points from medical reports, biological data, and genomics data to enable that precise and precision medicine coming from multiple and different hospitals around the world. And we're doing it using our AI platform that anonymize and remove all the PI information that is in those medical records to make sure that it's never possible to go back and take it, all the personal information, and also to understand it and merge it, put it all together to build that graph that can provide those unique insights to improve the woman's health. So we are using AI. We are spending a lot of time to make sure that it's completely anonymized, secure, and it only build it to build the good things that we want to provide for women's health.
Sheryl, of course, very passionate, I'm sure Tom too, about equality here and underserved community of women, but she's also a shrewd business person, both of them. And I'm interested in where the money, therefore, comes into your business. You're partnering with clinics. Are they paying you? Where does the money flow back to you as a technology provider? So first, we're talking about half of the population, okay? So any business that is targeting half of the population should be a very good business, that by default. And second, as I said, we are working with those clinics and those fertility companies and fertility labs and genetic labs to improve their products in order that they can provide better care to improve the outcomes. In this case, starting on fertility, there is room for improvement, even though it's a great technology, doctors are doing great, but there is a room for improvement. So our business model comes working with those clinics and helping them to provide better tools and better solutions to all their patients, and it's going really well. Our revenue is growing. As I said, we are not just growing quickly and fast in the US, but also in South America and in Europe, and the business is doing very well.
Juan Carlos, what is it that Cercle has done? Is it your own competence in machine learning, AI, or do you go to technology partners and take the work that others have done in AI to build out the underpinnings of the platform?
We build it our own technology, okay? So in order to build the scale and the resolution that you need to provide precise medicines to billions of women. And you need to understand, in our body, we have 37 trillion different cells. So the scale that we need and the amount of data, it's very important. There are a lot of companies that they can have billions of patients into their data, but they don't have the resolution in order to understand what is working or not working across all of those different women. This is similar to if you want to drive between San Francisco and New York, you want to use maps that has all the data and all the resolution to make sure that you are taking the right direction all the time, you don't get lost. But also it has the scale because you want to go to all the different cities in the United States. To do that at that scale without human intervention and only using machines and in the secure way, like Caroline was suggesting, you need to have advanced machine learning technology that we have developed in-house, yes.